Welcome! It is that time. It is time for Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. My name's Dr. David Geier, orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Very excited to be here. Beautiful day. Unlike the really crummy weather day you heard me talk about yesterday on Better Than Ever Live. Beautiful, beautiful Friday afternoon here. Akash, it is good to see you. I always love good night. I always forget that a whole lot of my followers, subscribers, whatever they're called on YouTube, are overseas, especially India and far out west, and so I know it is late your time. This is just the time on Fridays that works best for me. Neelam, I'm very glad to see you. Two people from India so far. If you have not been here for Better Than Ever Live before, this is how it works. I will answer as best I can any medical question, whether it's health, whether it's wellness. We can talk about thymosin beta 4 that we talked about yesterday. We can talk about anything really, peptides. We can talk about anti-aging stuff, or like what most people ask, if you have a question about an orthopedic problem, sports injury, exercise injury, or maybe a surgery, maybe a recovery from that surgery, I am happy to discuss it. This is not medical advice, though. Yes, I am discussing that topic and giving my thoughts on it, but I am not telling you what to do. I haven't seen you, I haven't examined you, looked at x-rays, MRIs, any of that. There is no doctor-patient relationship here. This is meant for general information and educational purposes only. To be fair, that's true in every video on my website and on YouTube as well. Also, there is no podcast version of this, unlike the Better Than Ever Live shows, and that's partly why I don't answer medical questions on Better Than Ever Live, because that is recorded for an audio podcast that you can get on Apple or Stitcher or anything like that, Spotify, Google Podcasts, all the places that have podcasts, and that's just not what that show is. So I do those every Friday, 12 p.m. Eastern time here, but that is the only place. Also to answer questions in response to comments on YouTube. I don't do it in response to questions I get by email, anything like that. I do it once a week, 15-30 minutes at 12 p.m. Eastern time. So I'm very grateful that you join. Also, couple other things. If you would like to see me as a patient, one of the great things, and I say this not necessarily to brag, it's just been one of the interesting things that's happened. In addition to having board certifications in orthopedic surgery and orthopedic sports medicine, I am pursuing my third board certification in anti-aging and regenerative medicine, and there just aren't that many orthopedic surgeons that do all that. Now, there will be a lot that do stem cells, because that's a cash procedure and it may or may not work okay, but there aren't that many that do a lot of these non-traditional treatments that I talk about sometimes, and some that I haven't talked about. So if you want to do that, I am happy to help. I can do, the only way I can actually prescribe treatments, perform treatments, things like that, is if you come to my office in Charleston, South Carolina. There's a link to my website in the description below this video. If you go to the upper right corner of the page, there'll be a drop-down menu. Click contact, fill out that form, and we can talk about that. I can also do coaching, where I'm not giving you medical advice. I'm not sending you the treatments or performing the treatments. It's just discussing it with you so that you can go to a doctor wherever you're located. I just started doing that and have people even set up as early as next week. So if you want to do that, reach out to me. I just can't do telemedicine with people in other countries or in states outside of North or South Carolina, because I don't have licenses in those states, and it's not legal to send treatments and perform visits if you don't have a license in that state. So it's one of the quirks about the United States, and all the states being very protective of their medical licensures, and that's why there's not a federal licensure. The states want the money from you having to pay for a medical license and apply for it. That's their main source of revenue, so I don't see that changing anytime soon. And I just don't have the time or really want to spend the money to acquire 48 other state licenses and to get and to keep those up every so often. So, all right, first we'll start with Neelam. What is the reason and pathology behind burning kind of sensation around the joints, and how's it managed? I'd have to see it. Oops, sorry about that. To tell you that I have a good sense. Burning typically, and this is a very generic first answer to that question. Burning, when I hear burning, the first thing that comes to mind when a patient says that to me is it's some nerve-related pain. Now, usually nerve-related pain doesn't manifest specifically as a joint pain like knee pain or hip pain or shoulder pain. Typically nerve pain, again, typically the somewhat generic answer, is more of a radiating pain. It radiates from your neck down your arm. It radiates like a sciatica, from your lower lumbar spine down your thigh, leg, into your foot and ankle. So that is one thing you think about. Another thing that can cause pain, I don't know if I necessarily describe it as a burning pain, but is inflammation and swelling of a joint. We've talked a little bit before in response to questions on this show about one of the reasons a knee swells or an ankle swells or a shoulder swells is the lining that surrounds a joint. So there's no lining on this knee joint, the synovial lining, the capsular lining that surrounds the joint, but that tissue makes the joint fluid in your knee, and it makes it in response to inflammation. And if that inflammation is going on, makes a lot of joint fluid, which hurts. The inflammation hurts and the swelling hurts. So a lot of times it's something related to that as well. And Akash, come on, get on here. Nick Neelam says hi. Hopefully, this wouldn't be the first time. One of my other shows, people were making friends with each other in the chat, which I think is always funny. As far as how you would manage it, again, it depends a little bit on what causes it. I am sort of lukewarm on anti-inflammatory medications, ibuprofen, naproxen type medications, because they have side effects. For some people, they can be really hard on your stomach. They can cause GI ulcers. You certainly wouldn't want to take high doses of that. I am a big fan of anti-inflammatory supplements like curcumin and epigallocatechins or EGCGs found in green tea. So there are green tea supplements that can be helpful. Finding whatever is causing the inflammation, whatever is causing the swelling can be really helpful. A lot of times physical therapy too can be helpful to get rid of swelling out of a joint and to calm the overall inflammation down. Somebody just earlier today asked me a question that I'll bring up here, even though I don't know that I've got the best answer for it. And that is, so her daughter had an ACL injury this fall, 16-ish years old, if I remember the story correctly, and had surgery, again, roughly October, and was really struggling with the emotional aspects of recovery. And that's a real thing in high school athletes, especially female athletes. But you can see it in boys too, but you really see it in the girls, because when they tear their ACL or suffer some long season-ending injury, they're no longer around the team. And that's a lot of times their sense of identity. They go into this grief response. It's really, really hard, and you really have to look out for it. And I'm a big believer in sports psychologists when you're dealing with these types of problems. Physical therapy can help too, because a lot of times somebody that's really good at rehabbing athletes, one, will see some of that depression and just sort of altered emotional response to injury, but can also help them work through the physical aspects of it and getting them more confident on it, which will build confidence and help with some of those grief reactions. So I'm a big fan when you're recovering from a surgery that, like an ACL, like a shoulder stabilization after recurrent shoulder dislocations, and a number of others, working with a physical therapist that specializes in athletes and getting athletes back to sports, because they can, one, help with the physical aspects of that if aren't addressed, if the athlete feels like he or she's behind, they get more and more depressed, but can also identify some of those grief reactions and have issues with that. All right, what else? If you have any questions, I'll stay as long as people have questions, but otherwise you're going to hear me ramble on and on and on until we end the show. Next week for Better Than Ever Live, which again, I have moved to 5 p.m. Eastern Time on Tuesdays and Thursdays. On Tuesday, we are talking about cryotherapy, standing in those chambers, exposing yourself to air 160 degrees below zero, and doing that for 3 minutes. And we're going to talk about what that's like, what it potentially is for. But one area that it's gotten a lot of attention is recovering from injuries, recovering from hard workouts, recovering from exercise and sports, whether it's practices or games. We're going to talk about whether or not cryotherapy is good for that purpose. It's a huge industry. There's a bunch of those cryotherapy places here in Charleston. I actually did it for probably about a year, maybe a little over a year, doing it 2, maybe 3 days a week. So we'll talk about that. That's on Tuesday, and there's some other great stories. We're talking health studies. We're talking about that day, and then on Thursday we're going to talk about a peptide. We've talked about peptides before. We've talked about BPC 157. We've talked about thymosin beta 4, and there's a number of others I'm going to talk about soon. But I'm going to talk about one that's getting a lot of attention. It's very new. It's called MOD-SC. It's been nicknamed exercise in a bottle, basically because in theory it acts on the same pathways that exercise does, and then in theory creates some of the benefits, if not all of the benefits of exercise, without actually having to go run for 30 minutes or 60 minutes. We'll talk about that. But where I really want to focus with that is in its potential role, a little bit about weight loss and body fat loss, but we're going to talk about it as it pertains to improved athletic performance, endurance, speed, power, that kind of thing. Really, really exciting discussion. Dinah, it's good to see you here. Can I purchase collagen from your office if you're not a patient? You should be able to. I know that we have supplements on our website, but I don't know that one is on there because we just got it probably less than a month ago. And so my guess is, because we are really slow to update our website, which is funny because I'm a big website person, but I don't deal with the website of our practice at all. So Nancy, if you want to go in the link below in the description, there's a link to my website. If you go to work with me and contact, just fill out it's like or just a real quick form, and just make a point of that's what you want to do, and I'll get it to people in my office who should be able to do that for you. That's easy enough. No, you don't have to be a patient. What she's asking about, and let me put it on the screen because she knows the specific one. Collagen, and you see GEN is capitalized, is a collagen peptide. One of the concerns, so I'm a big fan of collagen. It's involved in our tendons, making our ligaments, making our bone, making our cartilage. One of the things about collagen, and there's collagen supplements everywhere. Literally, I put collagen in my powder in my coffee this morning. Now, I used the collagen, which is a collagen peptide, as opposed to the collagen that's sold by most people. One of the theories, or one of the problems we think with collagen powder supplements, is that it's not well absorbed orally. But this collagen peptide is made out of what's called Fortigel. It's from Australia. It's a collagen peptide that is absorbed well orally, and it's got by far the best research studies to show that it improves healing, it improves pain. It's been shown to improve the recovery rates in college athletes. So I'm a big fan. I just am, and I will tell you that unlike some collagen powders, and I don't really have a dog in the fight. I don't have stock in the company or anything like that. But I don't notice a flavor with it like I do with some other collagen powders, for what that's worth. So if people are interested in that, there's a link to my website. I'll forward it on to our pharmacy and things like that. Okay, what else out there? Neelam says, any supplements to get rid of joint inflammation and swelling? Okay, so this is really, I want to say it was last week, it may be 2 weeks ago, that I did a Better Than Ever live show about supplements for osteoarthritis. A lot of the ones I talked about there apply to what Neelam just asked, but here are the ones that I personally take. This is not medical advice, so when I tell you these are things I take, I'm not telling you to take them, I'm just telling you there may be things you think about. Nancy mentioned one, the collagen. Now that isn't necessarily targeting the inflammation, but it's targeting the what the effects of the inflammation, which is breaking down the cartilage, breaking down the cross fiber links in tendons and ligaments. That's what you have to remember about inflammation. Sorry, this is more than you wanted to know, Neelam. The problem in inflammation is this upregulation of pro-inflammatory cytokines, things like interleukin-1 beta, interleukin-6, tumor necrosis factor alpha, which also activate matrix metalloproteases like MMP2, MMP9, which are very destructive to the structures in our joints, the articular cartilage, the bone, the tendons, and the ligaments. And you've got to turn those off. Advil and Aleve, ibuprofen, naproxen really don't do that very well. That's why I sort of laugh when these urgent cares and emergency rooms tell people after they sprain their ankle or do something to their knee to take Advil and Aleve. It might be actually somewhat counterproductive. There's thought that those don't stop the pro-inflammatory cytokines, but they do block the anti-inflammatory cytokines. That's not really what you're getting at, though. Let's talk about supplements that have been shown to stop those pro-inflammatory cytokines. There's three that I would start with that I would think about. One is curcumin, the active ingredient in turmeric. Turmeric is a powder, is fine. It doesn't taste terribly good, but in small amounts is fine. There just isn't that much curcumin in it. So you might take a curcumin supplement. That's something that we have. We've actually made one through the lab that we partner with that has curcumin, it has MSM, it has glucosamine, it has chondroitin, some other things too. I can't exactly remember, but curcumin's the main part of that. But curcumin's been shown in research studies to reduce the inflammation and reduce the pain in osteoarthritis and maybe even slow the progression. So curcumin would be one. Epigallocatechans, e.g. CGs that are found in green tea, are fantastic for stopping those pro-inflammatory cytokines, and they have a ton of other benefits. High blood pressure is thought to be good for your heart, thought to be good for potentially anti-cancer. It's thought to be good for body fat. It's thought to be good as an antiviral to keep you from getting sick. I'm not promoting saying, again, I'm not saying do this, and it's going to prevent you from ever getting sick. But I'm a big fan of green tea supplements. The problem with green tea is they don't, just a glass of green tea, a cup of green tea doesn't have that much epigallocatechans in it, which is where the supplement form may be good. The third one might be surprising, and I don't know how much. I talk about it a little bit in that supplements for osteoarthritis talk and some research, but it doesn't get a lot of attention. But I'm a big believer in omega-3 fatty acids, EPA and DHA, potentially for joint inflammation. I know they're not marketed that way. They're marketed as a heart benefit, and that is absolutely true, both from a high blood pressure and lipids, cholesterol markers reason, all for that. But it seems to be positively beneficial for inflammation as well. So those would be the kind of the three I'd start with. I've heard talk of a number of others. Somebody sent me one today. One of my patients sent me this supplement that he got. It was some pro joint supplement, and it had all kinds of stuff in it that I want to look up because I wasn't familiar with about half of the ingredients. But which is funny because I not very long ago did the chapter on nutritional supplements for all these different uses, and so there's hundreds of them in there, but even these had some I didn't really know very well. But those would be the three I'd potentially start with. Some people talk about magnesium, which is probably not really all that helpful as an anti-inflammatory, may have some benefits, but very good for bone health. Vitamin D, probably in a lot of the same way, might be beneficial, but those are where I would start. So done an opinion about hamstring graft strength. Hamstring graft strength. So there's a number of different ways you can do I'm assuming we're talking about ACL reconstruction with either what's called autografts or allografts. Here's my, as people like to make fun of me saying, my handy dandy knee model. All right, this is the handy dandy knee model. Pull the kneecap away. The ACL, this ligament running, let me turn this right, running right in the front as a cross, like you cross your fingers, ACL and PCL. And you can use an autograft to make a new one, even though, yes, there's this trend slowly starting to come out. We're still waiting on more data about actually repairing the ACL. But right now, the gold standard is still ACL reconstruction with either an autograft, which is tissue from your knee, or an allograft, which is tissue from a cadaver, somebody that dies, the organs are harvested. I am not a huge allograft fan, except maybe in cases of revisions or something unusual, something that's not at all active, but even then I don't particularly like it. Those grafts have a much higher re-rupture rate, the much lower load to failure rates levels. So I like autografts. For years and years, the gold standard was patella tendon with a piece of bone on either side, sort of the middle part of your patella tendon. The hamstrings are not on this model, but they would be tendons that attach right at the inside top of your knee. You just harvest one of those tendons typically and fold it over 4 times, a quadrupled hamstring graft, which generally shows pretty equivalent strength rates, patella tendon and hamstrings. The sort of newer one that is being used is the quad tendon graft, which is above the kneecap up here. That is potentially a good option as well. I don't know that I feel strongly. I think all 3 of those can be good. I think they might have some benefits, like one might have benefits more than another depending on who the patient was. So there are a lot of sports medicine surgeons not big believers in hamstring grafts for females. There's thought that maybe they have a higher failure rate in females. There's debate about that clearly, and that if you take the hamstring tendon in a female athlete, you're making their quadriceps to hamstring strength ratio even worse. Men are pretty equal, quadriceps and hamstring firing with physical activities, whereas women are much more quad dominant than they just don't, their hamstrings don't fire as much as their quads. That's thought to be one of the reasons they have higher rates of ACL injuries. So if you take the hamstring tendon, the theory goes, in a female athlete to use for an ACL reconstruction, you make that quad hamstring imbalance even worse, and then they can potentially end up with a knee that hyperextends abnormally and things like that, which I've actually seen in ACLs done by other surgeons. So I'm not really big on hamstring grafts for females, but again, I know a lot of surgeons that do it and have had great results with it. I haven't really gotten into the quad tendon graft as much as some people that are doing a lot of them now, but that can be a good option. So depending on the right person, I think hamstring graft can be fine. Almerzon, it's good to see you. I appreciate it. Neelam says, thank you. You're very welcome. Hope you have a great night. If you're signing off, a great night there in India. Paul says, quads burn really badly at times throughout the day. I don't know that I have a good answer for a muscular burning pain, especially at random times throughout the day. The first thing that comes to mind would be some sort of electrolyte imbalance, maybe low magnesium, low vitamin D, potassium levels, sodium levels out of whack. I'm not really sure. That would be easy enough to look up there's basic lab tests that you can get, a CMP that would show that kind of thing, and a 25 hydroxy vitamin D level would show vitamin D levels. But short of that, I don't know that I've got a great sense of bilateral burning pain, especially quads. The other thing you think, anytime when you got some sort of unusual leg pain, again, this is typically more one leg than both, but you also think lumbar spine and some, like we were talking about at the very beginning of this show about burning pain, some kind of lumbar spine neurologic issue that's radiating down the legs. Lots of India people today. You guys need to all get together and chat sometime, become friends like Neelam and who was that earlier? Akash were doing earlier. It's good to see. I want to try to say your name. Colia, I don't know if I'm saying that right. It's good to see you. Dinah, hamstring tendons are not thought to regrow when you harvest it. That's true with any of these. Quad tendon and patella tendon you can kind of close, sewn back together. I know there was thought that hamstring tendons regrow. I don't think that has been proven to be true. If somebody knows that it is and has a study to show that, send it to me, but I am not aware of that, and you are very welcome. All right, that is it. I'll hold this up. I held it just long enough. Mary's is going to be the last question for today. Fractured femur 2 years ago, trouble building strength. Okay. And I will sign off on this because this is a topic where what I do now is I'm able to sort of influence things differently than I could in my prior practice. So typically what we did after femur fracture, really any injury, mainstay of getting strength back is physical therapy. And I am a big physical therapist, and I've worked really hard over my career to figure out which ones were good, which ones would really lay hands on patients, really try to figure out the source of the problem, and really go at it, specific exercises tailored for that patient, and that's invaluable. I'm a huge fan of physical therapy, but you got to find the right one and do it. That's sort of what most people, traditional orthopedic surgeons, are going to tell you. One of the things as I get a little bit more into anti-aging and regenerative medicine that are things that you kind of think about a little bit are things that improve muscle strength. And one of the things that does that, everybody's probably heard of, is human growth hormone, or HGH. Now, I'm not a huge HGH fan, and I don't give it to patients because it's got problems. It can cause joint pain and swelling and carpal tunnel, and it's thought to increase visceral fat, which is the fat inside your abdomen around the organs. It's thought to increase the size of your internal organs, what we call organomegaly. And it's got a number, it's thought to be bad for your heart. Now, maybe not in small amounts, maybe it's okay, but there are better ways to do it. One of the videos I'm going to do in a Better Than Ever Live soon is the topic of growth hormone releasing peptides. So these are peptides like BPC, like thymosin beta-4, like MOD-SC that we're going to talk about next week. These are peptides, short proteins or short chains of amino acids that are naturally made in your body that can be synthesized in a lab and given as a medication that can do various functions throughout your body. And there are peptides that release growth hormone that your pituitary is already making to then do its actions throughout the body, including increasing muscle mass and strength. I equate growth hormone releasing peptides to skydiving. If you go skydiving and you're standing in the plane, the door's open, and you're unwilling to jump out, the instructor kicks you out of the plane. That is what a growth hormone releasing peptide does, is it kicks out the growth hormone that your body, your pituitary is already making, and it goes into your body. And it's probably safer and able to keep growth hormone levels at a better, in sort of a homeostatic range, not too high, not too low, but to help improve muscle strength. Probably, I don't know, it's been studied that much for this purpose, but probably has a role in helping people recover from injuries and recovering from surgery. All right, Collier, very nice to meet you too. All right, I said Mary's would be the last, but Almerzon's going to be the last question for today because I'm in a really good mood, and it's a sunny day, and I'm about to go work out, which makes me happy. Discoid lateral meniscus tear, 2 months, muscle strength exercise problems when I'm doing it. I can feel a pop in and around the knee. So I don't know this. This is one that's hard because I can't examine you. There's all kinds of reasons for popping in people's knee. Usually they're not bad. It is possible that there's a little tear in the meniscus that's catching between the femur and the tibia that's causing popping, but generally 2 months after surgery you would hope that's not the case. One of the things, and again, it can be a small buildup of scar tissue. It can be that the knee is a little swollen, so the kneecap doesn't track perfectly normally in this groove, and so you get a popping sensation as you go through a range of motion. We don't, as orthopedic surgeons, typically get that worked up about popping, because a lot of times if you feel the knee, the best example would be if you know any high school girls, like if you find a high school girls soccer team and put your hand on their kneecaps and have them bend their knees back and forth, about a third of them you'll feel a popping sensation. But if you were to scope their knees, they would look completely normal. Not all popping is because there's some loose cartilage or torn ligament or anything like that. It's just, kind of how their knees go, maybe softening the cartilage or anything like that. So we don't get terribly worked up about popping unless it's exquisitely painful, and then we go look for the cause of it. But going in to scope the knee just for popping when an MRI doesn't show any structural damage doesn't typically get you that far. All right, that is all I got time for you. If I didn't get to your questions, I am here every Friday at 12 p.m. Eastern Time. Very excited to have all of you here. Very, very much much appreciated. I hope this helps. If I'm going to take time from doing it out of my schedule to do this, I do hope it helps. I hope wherever you are, you have a fantastic weekend. Remember, join us Tuesdays, Thursdays, 5 p.m. Eastern for Better Than Ever Live. I will see you next week. Have a